So, is this your first time here in Serbia or Zlatibor?
Yes,
Uh-huh.
it is my very first time. Andrew?
I've been before either of you were born, I would say. But I've been several times, yes.
Yes, so what are your impressions since you're here for the first time?
Well, the area is beautiful. I come from Italy and I live in a similar area. I like very much hills and mountains, and this looks amazing here.
How are you, so to say, satisfied with our organization so far?
Absolutely. It's been a very well organized congress. There are a lot of people. There is a very good participation also from the invitees. And the topics that have been discussed, I believe, are very important for the daily work of all the doctors and nurses that are here.
Why is sterilization so important, so to say?
I leave the word to Andrew here, who is our expert in sterilization.
Well, the first thing I would say is I've been to many distributor meetings over the years, and this is by far the most professional organized one, and you can tell how much planning and time has gone into it, and this is a reflection of the professionalism of the company itself.
You can see that.
You can really see that. The sterilization, as I mentioned, is just one part of the process, but it's a very important part. And I think everybody in the room, some people come from areas where maybe there's not so much financing, in other hospitals more, but everybody's trying to do the best that they can, and we're just trying to help them with the standards and also show them how they can get the best out of any situation which they have in their hospital.
And if we speak about the future of sterilization, because on one of these few lectures you had today, you mentioned future time.
Mm-hmm. So today we are measuring, do we have the right temperature, the right pressure, but in future we have the opportunity to also measure the quality of the steam inside the chamber, and nobody's doing that today, yet for sterilization that is really, really important.
What do you think is the place of say, the e-commerce and Serbia and all the region in world of sterilization?
I think that if you look at what has happened in Central Europe, like the Czech Republic and Hungary and Slovakia, they've received a lot of funds from the EU in order to modernize their hospitals and to be able to buy sterilizers, etc. And what yourselves are doing is creating the understanding about what can be achieved. So hopefully when finances get a little bit easier in Serbia, then the hospitals will be able to benefit from that. But one of the things that's really important also is endoscopy, where many of the procedures are becoming now not classical surgery where you're cutting open, but you are making smaller holes, or you're using the mouth or other orifices to do the surgery, and that is where my colleague is really an expert in endoscopy, and she's going to be talking about that tomorrow. It's a very important area.
Yeah, if I can add this, talking about endoscopy, what we are seeing in these last years is that the endoscopy practice has shifted from being a mere diagnostic practice to an operative one. So in this sense, sterilization is very important, because this morning we saw the classification of the medical devices into critical, non-critical and semi-critical. Endoscopes are so far considered semi-critical devices, so they just need to undergo a high-level disinfection and not sterilization. But what we are seeing nowadays, and what the future will bring, is that endoscopes will be used more and more for operative practices that will touch also blood and the tissues of the body. So sterilization will be more and more important also in endoscopy departments. Tomorrow we will talk about the importance of the separation of clean areas from dirty areas to avoid cross-contamination between one and another. So sterilization is a big issue also when it comes to endoscopy, for sure.
Thank you very much. That would be
To you.
all.